friends. Welcome back to In Their Words, the podcast that brings you the voices and stories shaping the landscape of health and humanity. In today's episode, we embark on a compelling follow-up journey, and we're privileged to have a distinguished guest with us, Dr. William Apollo, a cardiologist with UPMC in Central PA.
My name is William P. Apollo, MD, FACC. I'm a general cardiologist, non-invasive cardiologist, and I've been with the system now a total of, this is my 27th year. I started college as an undergraduate at Penn State. My major was biochemistry. Initially, I thought that I would end up perhaps working in a laboratory in pharmaceutical industry. I always liked science and chemistry and math. And when I got involved with the major, I started thinking more about a career in medicine, maybe when I was a junior in college. And at that point, I decided to take the med school entrance exams and did well and decided on a career in medicine.
In a rare and compelling twist, Dr. Apollo shares his deeply personal journey with heart health, a narrative that intertwines with his professional expertise. As a seasoned cardiologist, he's accustomed to navigating the complexities of cardiac care for others. But what happens when the tables turn and his own expertise must come into play in his life?
I had always been a healthy individual, no heart-related problems, no family history of heart-related problems, and generally blessed with good health all my life. And I've been an athletic individual my entire life as well. I still continue to run and ride my bike, still continue to race and do duathlons. And I began to experience palpitations and lightheadedness and dizziness, and was ultimately diagnosed with a fairly significant heart rhythm issue involving the bottom portion of my heart called ventricular tachycardia. When I discovered that I was experiencing symptoms, we were able to document the heart rhythm problem on an EKG in the office one day. And I was seen by one of my partners, an electrophysiologist or a heart rhythm specialist within the group here. And we decided that the best treatment in my situation was to have an ablation completed rather than going with medications. So I ended up having an ablation, and the situation was cured. And fortunately, I've been back to good health and normal exercise pattern and still continue to race and so forth.
We now find ourselves at a unique intersection where medical expertise meets heartfelt advocacy. Dr. Apollo not only stands as an advocate for heart health, but also champions the cause of the Peyton Walker Foundation and the 4-Minute City.
Heart screenings are important in young kids. You know, knowledge is power and information is power. And with a simple screening test, the idea is to try to tease out young athletes that could be at risk for a significant heart problem before they actually have some sort of a catastrophic event. And many times, if these things can be discovered kind of at an early stage, many times they can be managed and sometimes even cured so that for a bad outcome from a heart standpoint. The 4-minute program, I feel, is a great concept. And the idea is to get life-saving medical care into the community so that if a patient suffers a life-threatening cardiac issue, hopefully they can receive treatment quickly because the proximity of the device may in fact be in their neighborhood rather than waiting for an ambulance crew to arrive and begin the process. So specifically, the 4-minute program addresses sudden cardiac death. And when a patient experiences an episode of sudden cardiac death, the objective is to restore a meaningful rhythm, a life-supporting rhythm as soon as possible. And things like CPR are certainly wonderful, and they play a massive role. But CPR essentially buys time until more advanced care can arrive. With the 4-minute program, however, you're getting automated defibrillators out into the community. And if a patient experiences an event, the system can be summoned. And if someone nearby has a defibrillator, they can go and provide aid to that patient. And hopefully, by doing a defibrillator according to the protocol of the device, they can restore heart rhythm and potentially save a life. I think it's a great resource, and I would hope that kids and families would take advantage of this sort of program. It's a great screening tool. The kids get a physical exam, an EKG, and their medical history reviewed while on site. And if anything stands out in those areas, we have the ability to do an echocardiogram or an ultrasound picture of the heart right then and there. Typical symptoms that patients would experience would be things like chest pain or shortness of breath, palpitations, rapid heart rate, chest fluttering, and also things like dizziness, lightheadedness, or the sensation of passing out or an actual passing out episode. I think all of those would deserve consideration and maybe an exam by a cardiologist.
What sets UPMC apart is not only its commitment to providing exceptional patient care, but also its dedication to pushing the boundaries of medical knowledge through innovative research. Dr. Apollo shines a spotlight on the noteworthy contributions of UPMC in Central PA, particularly in the realm of clinical trials.
I think our involvement in clinical trials here is high, and we probably participate in more than most typical hospital situations, especially when it comes to therapies like non invasive valvular type procedures, especially with aortic stenosis and TAVR. That has been a big deal. We also do quite a bit with device therapy in the electrophysiology lab, as well as other things like Watchman procedures and amulet procedures. So it's pretty active when it comes to things like that.
In a poignant moment during our conversation with Dr. Apollo, we're reminded that behind the medical expertise and professional accolades, there beats the heart of a compassionate human being. Dr. Apollo graciously opens up about the profound impact his patients have on him, particularly when they express their gratitude.
Uh, wow, wow, it means the world. I think being a cardiologist is more than just a way to make a living because it allows you to connect on a personal level with patients. And generally, when people become involved with a cardiologist, it's a long term relationship. And with time, these patients aren't just patients anymore, they're friends, and it becomes a long term relationship. We become interested in how one another's families are doing and how the kids are doing and how summer vacation went and what did you do for the holidays, those sorts of things. And it can be very rewarding on that level.
In the tapestry of today's conversation, we've explored the nuances of heart health, the importance of clinical trials at UPMC and Central PA, and the profound significance of the Peyton Walker Foundation. Dr. Apollo's personal experiences and heartfelt reflections have added a unique dimension to our understanding of the intersection between medical expertise and human connection. As we part ways for now, let these words resonate. Every beat of the heart tells a story, and in each narrative, there's a call to action for a healthier, more resilient tomorrow. Thank you for joining us on this journey. Until next time, remember that In Their Words is not just a podcast. It's an exploration of the stories that shape our collective well-being and the voices that inspire change. Stay well, stay connected, and keep listening to the beating heart of humanity.